Hello and welcome to YHTV's Magical Medical Tour. This is episode 34. I'm Christina Suzama, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Glenn. Hello, Glenn. Are you out there in cyberspace?
Can you hear me?
I can now.
Yeah, that's good. I'm really happy that we named it Magical Medical Tour because it does seem magical. When I tell it to people and I'm talking about the show to different people, there's always pretty good reactions, especially from the crowd of people that went through kind of the Beatles era, so they can recognize it from that point of view. But a lot of people seem to really vibrate with the name. And speaking of those people, greetings everyone, and welcome to Magical Medical Tour. Dr. Glenn Woolman, I will be your guide along with Christina as we explore each week another quadrant of the healthcare galaxy, searching for ways toward optimal health. And we're going to do that today. We have a special guest with us today who has been on Trinity of Life, in fact. You've interviewed him before. How many people get to do this? Is like a double header, or it's a Quinella or something like that.
Yeah, we'll just ping pong him back and forth. How's that? I want him this week. No, you can have him. No,
yeah, well, the pressure's on for me to actually ask questions that won't be on the other. So we're interviewing Dr. Nick Bitz today. He is a naturopathic physician, and he has, as we said, spoken on Trinity of Life to a great audience who have been, he's helped them in many ways, and there's great reaction. So we felt it would be a good idea to approach it from Magical Medical Tour point of view, and that fits in with what we do, trying to explore different ways of health and healing to give people information for their own healthcare plans, but also to let people know that there are many types of programs out there that people can get involved in if they have any interest in being a healer. So I think without further ado, I don't have to introduce him to you or to most of your audience, but to some of the audience that may watch just Magical Medical, Dr. Nicholas Bitz. Welcome, Nick.
Greetings. Thank you for having me on today.
Hello, Nick. Welcome back to another quadrant of YHTV.
Yeah, this is a quadrant. So, Nick, as the medical guide, what I like to do is sort of give everyone a plan as to where we may be going today. And I would like to start out just a little bit with your journey of how you became a healer, what interested you. I know some of this is on Trinity of Life, and I would refer to people to see your episode. So we'll spend a little time on your journey, and then I want to spend a lot of time talking about what naturopathy actually is, what's the training you go through, and what people will learn if they go to a naturopathic doctor, and why they should go to a naturopathic doctor, and a number of other things. And maybe we could have some discussions a little bit about the environment and supplements and different ways of looking at healing from a Western point of view. And I guess naturopathy is somewhat Western also in a way, but we'll find that out today. How's that sound to you?
Perfect.
Perfect?
Yeah. So I guess just a little bit about my background. As some of you may know, I'm a naturopathic doctor. I specialize in integrative medicine. I really do blend the best of conventional medicines with the best of natural medicines. I am an expert in gastrointestinal disorders, Ayurvedic medicine, and dietary supplements, and have spoken at great length with Christina about environmental medicine, which is one of my passions and loves clinically. I think, my journey really began when I was probably 12 years old. I can pinpoint one episode, one event in particular that really led me on the path that I'm on today. And it all started when I fell out of a tree. I was, 12 years old. When you're that age, you do not think that you can have any problems with your health. You think that you're going to live forever. At that point, I really uh, I got a taste of my mortality, for lack of a better term, and I really understood at that point that I was prone to disease, and that I could actually have health problems. I was actually paralyzed for about 5 minutes, lost all feeling in my limbs. I did regain all of that, fortunately, but it was through a long, very long process of Ayurveda, acupuncture, diet, and really just a lot of self-healing. I really was on the path to get my traditional medical degree when I was interviewing for various schools around the country. I was up at University of Washington up in Seattle, interviewing for their medical program up there, and actually stumbled upon Bastyr University, which is one of 5 naturopathic medical schools in the U.S. And I didn't even know that naturopathic medicine was an option. I had no idea. But I knew that, immediately that it was something that I was interested in. I'd always had followed Andrew Weil, had really gotten into herbal medicines, gotten into diet therapies, and such. And so I knew that it was within the realm of possibility for me. And so I actually just kept going down that path. Of course, my family was a little bit skeptical. Friends were very skeptical. A lot of my mentors were very skeptical. But I think I knew in the bottom of my heart that I really wanted to study naturopathic medicine, because it really is a nice, perfect blending of the conventional wisdom with a lot of that old traditional wisdom. And it brings those two together very fluidly, I think. And I think it really is what's needed in today's healthcare system. So hopefully we can touch upon a little of that today.
Yeah, I'd like to. I would like to stay on that 12-year-old falling out of a tree process. Did you say that at that time, in order to be healed, you did have Ayurvedic medicine and a number of other medicines at that time?
Yeah, I really was forced to. I had to seek out all the alternatives. I was going to the traditional MDs, getting the imaging of my spine, my low back, and everybody told me that everything was normal. And they said, "Well, I don't know what's going on. This is a head scratcher. You shouldn't be in pain. You should be recovering. This shouldn't be an issue." But I was in pain every day, and if I went for a run, or if I played basketball, or I did anything active, it would really aggravate my whole problem. And so, really, I had no other choice. And as I've talked about before with Christina, I was fortunate that my mom really kind of opened the door and said, here are some alternatives. Let's start on some acupuncture. Let's start working with your diet. And let's really, let's do adjustments. Let's work with chiropractic medicine. Let's start looking at your body type, all of these things. And little by little, I started seeing improvement. And I started to understand that really my healthcare journey was really in my hands, and that other people could not help me. It really was about me taking a proactive role in my own healthcare.
Yeah, it's interesting that I'm trying to think of all the parents that I grew up with, not just mine, but all of my friends, and I don't think any of them ever maybe even knew the word Ayurvedic at that point.
You're right.
So it's fascinating that you had that opportunity and a mother that was so open like that.
Yeah, I definitely agree. And I was fortunate in middle school to have a hippie teacher who drove a VW bus, and really knew the virtues of Buddhist meditation. And I actually used to do a lot of traveling with him, and he actually taught me to meditate at a very young age as well. And so I think it was, it's a lot of things that just happened to come together at the perfect time. And the medicine part, the self healing part, the Buddhist part, the spirituality piece, they all kind of came together very nicely for me.
Yeah, that's is pretty amazing. We all need hippie teachers. Probably helped most of us
It's
for
true.
many years. Um, so now you went into naturopathic medicine, and I'd like to have you tell me and our audience a little bit about the training that goes into that, and how you believe that it's different, say, than conventional Western medical training. What are the things that are added and different that you go through in your training? How long is it? Give us a whole detail.
Well, every naturopathic medical school in the U.S. is a 4-year postgraduate medical school degree. So you are required to get a bachelor's. Most naturopathic doctors have very eclectic backgrounds. They're not necessarily pre-med majors, which I think is a fortunate thing. You don't have all of these little science gurus running through the naturopathic medical schools. It's people that have degrees in law, people that have degrees in English, people that have degrees in business, very seemingly unrelated fields of medicine. But I think that really kind of broadens the practitioner, in my opinion. So it's a 4-year comprehensive medical training. We do get the traditional conventional medical sciences. We do have the anatomies, the physiologies, the biochemistries, the pharmacologies. We're getting all of that. We're also getting the clinical and physical diagnosis piece, diagnostic imaging. As I mentioned, the pharmacology piece. We're learning all of the pharmaceutical drugs. We do minor surgery. And in addition to all of these conventional medical sciences, we're also doing naturopathic philosophy, and we're doing all the things that really make naturopathic doctors unique. So we're working with clinical nutrition, botanical medicines, homeopathy, physical therapies, such as craniosacral therapy or chiropractic-like adjustments, different types of body work. We do learn counseling skills. So it really is kind of a very well-rounded education from my standpoint. I don't think it's any one thing. I really think that the thing that differentiates naturopathic medical students from conventional medical students is our philosophy. And you'll find that most naturopathic medical students tend to kind of walk their talk. And I found that, for instance, up at Bastyr, you would walk into the cafeteria and everybody would be eating these whole food, organic, home cooked meals all the time. And it really is just this enculturation of a healthy lifestyle that I think really separates us from a lot of the traditional MD students who I think are really just pushing to excel in their studies and to be excellent doctors, but they aren't necessarily pushing to be an example of wholeness and wellness and health for their patients. Some of them are, but it's not closely incorporated with their medical training.
Yeah, I think I would tend to agree with that, although I'm seeing more and more of the Western medical students getting into health more, probably from what they're seeing in the outside world. Do you have I know in medical school, we usually have our first 2 years or more of the sciences, as you mentioned, and then we go up onto the wards, clinical areas. Do you have clinics in your school where people come there and you follow them over periods of time? Is that the same? Do you go to in the hospitals? Do you go on wards and see people that are being treated in a naturopathic manner?
Yeah, absolutely. We actually have built into every naturopathic medical program, there's at least 2, maybe 3 years of clinical internship. And so you work with physicians in the area. You actually are working with patients one-on-one, and with other students, to treat patients from their first office call, their return office call, and you really get to see the progression of their healthcare. We do have at Bastyr, for instance, we do have a Bastyr Center Health Clinic, which is in downtown Seattle. Plus, we have all of these satellite clinics throughout the greater metro area. I did do rounds in hospitals with MDs, with osteopathic doctors, with other NDs. I did rounds at cancer centers with naturopathic physicians that are working there. And, in addition to the clinical internship, um, a lot of NDs are starting to do residencies. As it stands right now, residency is not mandatory as it is in conventional medical training, but more and more residencies are now available to NDs once they graduate. So, for instance, I did my residency in Vail, Colorado, in an integrative medical clinic there.
What other types of residencies might there be for someone?
Well, I would say overall they tend to be very general. I think that as NDs, we're trained as primary care physicians first and foremost, and so I would say that we're generalists. I would say that by and large, most of them are generalist typed residencies, but I would say that there's a growing number of specialty residencies that are available. So we do work closely with the Cancer Treatment Centers of America. And so you will see that the NDs are on staff there. Plus, there's always 1, 2, maybe 3 residents that are working there as well. We do have residencies specifically in cardiology, specifically in dermatology, urology. So we're starting to find these new kind of cutting edge specialty residencies. But again, they're not a dime a dozen. Not every ND chooses to do that. And again, nor is it mandatory for every ND to do that. But it is, I think, it's invaluable to work with somebody as soon as you graduate that can mentor you, that can teach you, what works. Working with somebody that's been in the industry for 10 years, they teach you what works, not only from a business standpoint, how to run a clinic, but what works with patients, what patients respond to best, what they have found to be successful, and really just how they lead their life. And so I've had several mentors that I've worked with that have really been quite amazing examples as what to aspire as a naturopathic physician myself.
It's always good to have these great professors that teach us. They are inspiring in many ways, and I know that in medical school, it's many times this very inspiring professor which helps a person to make the choice of what specialty they want to go into. They didn't really have an idea, and they still don't know, but they were so inspired by a professor and the way that they carried on their life and took care of their patients and taught, that it helped people to make those decisions. It's interesting that you bring up the Cancer Centers of America, because in our future, I'm planning on interviewing a number of people that I have worked with at the cancer centers, where I had a client that had a cancer and was treated at a cancer center, and I worked with the medical doctor and the naturopathic doctor, and it was wonderful to watch this process where they were getting conventional uh, chemotherapy, although they were not in the normal conventional doses. They were in different types of doses, but then they had the naturopathic medications that they were also getting, which seemed to augment the chemotherapeutic medications and also to keep down the side effects from them. So I have some experience with that, and I think that's a great thing. It's probably a great model for our future. I'm wondering, within the process of naturopathy, and again, I always relate to Western medicine first, we do a lot of things where we're doing evidence-based studies, and we do scientific controlled studies to see, are we doing this right? Is there a better drug? Here's a new drug. What's done in naturopathy to see that the things that you're doing are in fact effective, or is there something new that's come around that we should test? How do you deal with that?
Wow, that's a great question, and I think it's a very large question as well. I think that there are a wide variety of naturopathic doctors. I think that practice, they have very different personalities, very different styles, very different set of tools that they use clinically. I would say that a lot of them, and this seems to be increasing, they tend to want to practice medicine from an evidence-based standpoint. And so they want to make sure if they're giving out the herb rhodiola for mood support, they want to make sure that they're giving out the specific extract that's been used in studies at the specific dose that has been shown to be beneficial. There are I would say a number of NDs that actually believe that it really doesn't matter what the science says, because there really is not a lot of science on our type of medicine right now. Yes, it's growing, but really there's not enough to say whether or not a homeopathic medicine will actually work, because you really can't do a double-blind, placebo-controlled, well-designed big study on homeopathy. You can't. It's impossible to do, and there are so many reasons why that is the case, unfortunately. But just because there's not studies doesn't mean that it doesn't work. And so I think that the gold standard from a naturopathic standpoint really is the clinical validity. Does it work clinically? And we have very big online groups called Naturopathic Chat. It's a Yahoo group. There are over, I think, 3,000, 4,000 members on it. And what we're doing is we're sharing our clinical pearls with everybody. So we're saying if a woman comes in with interstitial cystitis, which is a very hard to treat bladder disorder, we can say, here's our patient and this is how she's presenting. This is what I'm starting to do. Does anybody else have any pearls or gems that they've gleaned over the years and they've found to be useful? And people will say, yeah, absolutely. There's nothing in the literature on using N-acetyl glucosamine, but I have found that, for instance, 750 milligrams twice per day is the best thing you can do, or using intravenous MSM is the best thing that you can do for this patient. And again, there may not be literature on this, but we're finding that we're communicating what works clinically. And so I communicate with my patients very clearly. There are studies on this or there aren't studies on this. I have found this to be beneficial for 75% of my patients. It doesn't always work, but let's give it a shot for you. If it doesn't work, then obviously we're taking the wrong approach. We really need to identify the root cause and come at it from a different angle. And so I think that touches upon it a little bit, Glenn. I think it's a very big question. I'm thankful, because I have a very scientific mind. I'm thankful that there is more and more research coming out on natural remedies as we speak. Every year, there seems to be more and more going into this. So I think that in the course of the next several years, we're going to see that most NDs are going to take a more evidence-based approach because the research is available to them.
Yeah, it's interesting that you say that. You brought up interstitial cystitis, and we had a conversation with Dr. David Cumes in one of our earlier shows. He's a urologist, but he's also an African Sangoma, a medicine man, and we discussed specifically interstitial cystitis. When you are taking care of someone, somebody comes to see you. So I'm assuming, sit down and do an intake or take a history. Do you do a physical exam? Do you run lab tests on a person? What kind of a workup does someone get from a naturopathic doctor, specifically yourself? And maybe you could talk about if there are some differences, as you alluded to, different types of workups, and how naturopathic doctors come to a decision about an illness or some type of a healing process that's necessary for your patient.
Yes. Personally, I like to make sure that my patient has a clear understanding about my philosophy, my background, and what I can do for them. So I always start my office visits with a brief introduction, especially talking about naturopathic medicine and the principles of naturopathic medicine, so that people understand kind of what they're getting into. It's a very foreign paradigm.
Can I interrupt
for most
you
people.
for a moment, Nick?
Sure.
And I want to continue that, but you mentioned the principles. So just to remind you, maybe you can finish your process and then go over some of the principles with us a little bit.
Sure.
But
yeah.
continue.
So, rather than working within the confines of an 8-minute office visit, I really like to give patients enough time to really tell me their true story so that I can understand them from a holistic um, standpoint. So I really try to give patients 60 to 90 minutes when I work with them, which I think is enough time for people really to open up, to tell me their story, and for me to start to create a little bit of a relationship with that patient. For me, it's really all about the relationship that is healing and that allows healing to occur. So, rather than focusing on treating symptoms with pharmaceutical drugs, I really try to identify the root cause. And so I'm really looking at, what is going on, what is causing this symptom. The symptom's there, but I want to know what has led to the embodiment of that symptom in your body or your mind. And my goal is really to create these customized treatment protocols using natural therapies or conventional therapies if need be. I do, within the course of that 60 to 90-minute visit, I do a full physical examination. It tends to be, in my opinion, more comprehensive than you find in most clinics, given that I'm doing a whole body physical exam. So I'm almost doing a full body comprehensive physical, which most people aren't really accustomed to. If need be, I'm doing blood work. I'm doing any kind of provocative testing, whether that be like food allergy testing or stool sampling or saliva testing, looking at hormones, whatever that may be for that patient. And then I'm really taking the time to sit down and to come to a consensus with my patient to talk about, okay, here's what I see going on. Here's how I think we can actually overcome these obstacles. And together, let's create a treatment plan that you agree upon, that is amendable to you, that you can do in order to get there. And so I really have a large conversation with the patient about the treatment plan and about follow-up and expectations. When should you expect to see improvement? Some people, they can see it in the next day. Some people, it'll take several months. We know that botanical medicines, they tend to be more food grade rather than a pharmaceutical. And so you need to use them in larger doses for a larger amount of time in order to get the same clinical effect that you would with a pharmaceutical. And so again, just really taking a moment to educate the patient. And coming back to that idea of principles, it comes back to the word doctor. And doctor comes from the Latin root docere, and docere means to teach. And so that docere, the concept of teacher, really is one of the key principles of naturopathic medicine, that we really take the time to teach our patients about themselves, about their bodies, about health, and then just about this different paradigm um, that they need to more or less embody in order to create health and wellness again for their life. I guess if we're going to talk about the principles, the first principle of naturopathic medicine is first do no harm. Every doctor takes the Hippocratic Oath. Again, in that is first do no harm. My intention is not to jump into pharmaceutical drugs, surgery, or to create more problems right off the bat. And so I'm using, if I use the analogy of a ladder, I'm starting at the lower rungs on the ladder. I'm not jumping to the higher, high force interventions right off the bat. We can get there eventually if need be. But initially, I'm going to start in the lower rungs and really just work with the diet, work with lifestyle, do some basic things and see if I can create some movement. The second principle is what's called the vis medicatrix naturae, which is another bizarre Latin term. But the vis really just means the healing power of nature. And so it's akin to qi in Chinese medicine or prana in Ayurvedic medicine or yoga. And so it's this kind of, it's more of a Latin type phenomenon. It's based in kind of nature cure, old naturopathic medical philosophy, in that you're really just allowing the body to heal itself through nature. And so the intent of every naturopathic doctor is to stimulate the body's healing response through the healing power of nature. And it seems very kind of esoteric and very philosophical, but I think once you start practicing, you really start to understand that the physician really is not doing anything for the patient. It really is nature. So, if somebody has a large cut on their arm, I can't pull those together, mend those up, and then like force the body to actually heal that. Somehow, miraculously, the body will bring that together and heal it up over several days. All I need to do as a physician is to give the body the building blocks, the vitamin C, the certain nutrients, et cetera, that can really help to stimulate that body's reaction. And so the V's is a very, I think it really separates us from most other philosophical systems and most other medical systems, this idea of the healing power of nature. And so first and foremost, I really try to honor that. And I believe, that the body has an incredible ability to heal itself if given the chance to do so. And so oftentimes my job as a doctor is really to get the person out of his or her own way and to let nature come in and really start the healing. Because I think that if you allow nature to do the work, people will spontaneously move in the direction of health. And oftentimes it's just themselves that are in their way, that are creating obstacles to health and that are disrupting the natural flow of nature and such. So the third one, really, as I've talked about a little bit already, is identifying and treating the root cause. And so again, I'm not looking at the symptoms. I am identifying and treating the root cause of your symptoms, your disease. And then again, that concept of docere, doctor as teacher. And then we have two that are a little bit newer on the scene. They've actually evolved probably in the last 10 years. The idea of prevention and the idea of wellness. Again, very basic, but I think that naturopathic doctors are preventive specialists. We really are, the whole saying that an ounce of prevention is worth a pound of cure. If you don't ever get to the point where you actually have a disease, then you've actually, there's no need to treat it. You're going to save money, you're going to save time and suffering, all of that. So I'm really trying to look at all a person's risk factors to make sure that I can prevent them from actually moving towards disease. And so I actually look at labs very differently than most conventional MDs because I'm looking at really where they're going. So even if somebody doesn't have thyroid levels outside of the levels of what's considered normal, it may be considered outside of what I consider to be normal. And so I might actually start looking at the thyroid function and actually start really making sure that I'm giving them the building blocks to build thyroid hormone, to make sure that they're speaking their truth, because the fifth chakra and the thyroid gland is all about speaking your truth, and to really make sure that you're really just fine-tuning that area of the body. And so I'm preventing the onset of any hypo-functioning later in life that may occur. And then this idea of wellness is, the absence of disease really is not health. Health is much more, it's a continuum. And so I'm constantly trying to make sure that people are moving in the direction of optimal health. And so I try to give people the tools to be proactive in their healthcare so that they are not passive. They're not disempowered. They're not apathetic. They're not relying on pharmaceutical drugs once they have problems, that they actually are taking their healthcare and their wellness into their own hands, and they're trying to be proactive in their healthcare.
Oh, now I need to take a breath there.
It's a lot, yes.
Wow. What I didn't realize all this time, Nick, is that the conventional medical world is so accepting of the naturopathic world. Because when you were saying that, you were in hospitals and you were working side by side with doctors and things like that, that I don't hear very much of. Usually, I believe in the layman terms, we don't see that very often. And I don't know if it was because Seattle is a little bit ahead of most parts of the country that they're a little more liberal with things like that. They're open to working with each other and seeing, how the patient comes first. So it's, the holistic approach comes in. And as a naturopathic doctor, are you able to prescribe the conventional antibiotics in medicine?
Yeah, I think that, you hit it right on the nose. I think that Seattle is very different than Los Angeles, where you and I are, Christina. It's, we have, as a naturopath, we have been licensed, I believe, 6, maybe 7 years now in the state of California. So it's relatively new. We have been licensed for a very long time in the Pacific Northwest. My scope of practice, when I had my license up in Washington State, was on par with every medical doctor up there.
Wow.
So I actually pretty much could give out every pharmaceutical drug, besides, some of the hardcore pain medications, which I shouldn't be giving out anyways. So yes, in the state of California, my scope of practice is a little bit less, but it's growing. And it is on a state-by-state basis, and so everybody needs to pay attention to the scope of practice that their naturopathic doctor in their state can actually use. In the state of California, we can prescribe pharmaceutical drugs that are natural. And so we do give out bioidentical hormones. We do work with thyroid medications. We do work with antibiotics. Again, if need be, I find that clinically, I don't need them. For instance, if a child comes in with strep throat, the conventional thinking would be you give that child an antibiotic immediately because of the sequelae and the potential negative consequences of that. I have found clinically that antibiotics aren't necessary. You can actually use herbal medicines and homeopathy to treat that child acutely. And if they don't get well within 1-2 days, then I might move into antibiotics. Again, in Seattle, I think we are very well accepted up there. A lot of NDs have hospital admittance rights. Every doctor, every layperson really knows what a naturopathic doctor is.
Wow.
You come down to California, and I would say that 9 out of 10 people have no idea what a naturopathic doctor is. And a lot of the conventional medical community doesn't yet either. I think that once they understand our training and our intentions, our philosophy, I think they're a little bit more open. But even in California, I would say that most people are pretty guarded about their medicine and their way of living. So little by little, I think we're kind of cracking the egg, cracking the nut, so to speak. But it's still it's a hard sell. And when I tell people I'm a naturopathic doctor, immediately people are, "You're a natural what?" Over and over and over. And so for me, it comes down to that whole docere, doctor as teacher. It really is just taking a step back, talking about a little bit about who I am, my training, and what I do clinically. And then it's always interesting too to get into the history of medicine. And you actually, if you look back in the early 1900s, there were more naturopathic medical schools than there were conventional, quote unquote, conventional allopathic medical schools. And so, sorry, that's my dog. And it's been very interesting to watch the evolution of medicine over the course of several years. And things have changed. I think that we're trying to move into a new era of naturopathic medicine. And I think in the next 10 years, we're going to see that new era of natural medicine. And I think that, well, just as an example, there's a new medical school, an offshoot of Bastyr now in San Diego that's opening up next month. And so we're starting to see, I think, this resurgence, this renewed interest in naturopathic medicine in the U.S., which is really exciting from my standpoint.
Oh, I think from mine too. Because it is because usually if someone's dealing in acupuncture or herbology, etc., they don't have the license to be able to prescribe other medications. You see,
Correct.
whereas for you, you are dealing in a holistic world by the sounds of it.
Yeah, absolutely. I mean, just given myself personally, and then who I work with. I actually currently work in an integrative practice
Mhm.
with an integrative MD, as well as an osteopathic physician, who both they're very accepting and very open to my type of medicine. So I
Mm.
think that just kind of opens me up to their world a little bit more, and it opens them up to my world a little bit more. And there's really this nice bridge between what we're doing clinically,
Mhm.
which is fun.
Oh, yeah. Okay,
Nick,
now.
when you talk about root cause analysis and you're doing your physical, I know when a traditional Asian medicine doctor is looking for a cause, they're looking at the tongue and pulse and a number of other things. And what does a naturopathic doctor use to look for a root cause analysis?
Well, I think the medical history first and foremost, physical exam secondarily, and then we have a whole route, whole a whole toolkit, I think, of medical tests that we use. It really depends on the naturopathic doctor. I would say that no two naturopathic doctors practice alike. Given my interest in Ayurvedic medicine and my training in Ayurvedic medicine, I do pulse diagnosis, I do face diagnosis, I look at the tongue. Um, I'm doing a lot of the provocative blood work, so I do food allergy panels, I do stool tests, I do saliva tests. I'm starting to do some genetic testing as well. And so it really is the whole gamut. Some naturopathic doctors prefer not to do any medical testing, whatsoever, and they rely only on the medical history. Others rely exclusively on doing blood work or these other provocative tests, and rely very little on the medical history. So for me, it's a combination of both, but I really do rely specifically on my Ayurvedic training for that, because it works so well, and I can really start to identify somebody's body type. And kind of understand what's happening on an organ basis. So looking at their liver, their kidneys, or their lungs, and understanding how all of that may be working together, and what may be kind of, at the root of their deficiency or excess, so to speak.
When I worked in emergency medicine, there were many times I would be able to either instantly or over a short period of time understand that this person that's come in with this issue, I can handle and send them on their way. And then there are others that I look at and say, this person, for example, has an appendicitis, they need to see a surgeon. So when you, as a naturopathic doctor, come to your patients, do you do the same thing and you say, this does fit into the realm of naturopathy, or this person is going to need someone else in another realm?
Yeah, and I try to, as I mentioned before, I like to really give people a really good overview of naturopathic medicine, so they have an understanding, and we can really come to terms. Am I the right practitioner for them? Are they the right patient for me? I've had several people that I have felt are not. They're either too advanced or they need somebody who has a different skill set than me. I may not be the best trained physician for that person. So for me, it really comes down to, I really take the time to make sure before I see a patient, is this a good fit first and foremost? But I do agree that there are certain types of medicine, emergency medicine in particular, is one area that I immediately will just be like, all right, this is out of my realm of comfort. You need to go work with somebody that actually focuses on this every day, day in and day out, and they would know what to do with you.
When you said a moment ago, you said patient may be too advanced. Are you speaking in terms of their knowledge base, or are you talking in terms of a diseased state?
Well, their disease state specifically,
Okay.
and yes, and thank you for pointing that out. It really, I think if somebody comes to me with a condition that I've never seen and they need help immediately, I could definitely be brave enough to take them on. I've treated a lot of chronic disease. I've treated successfully a lot of irresolvable health conditions. Um, but if somebody comes to me and it's not my field of expertise, for instance, autism. Autism is something that I'm learning to treat, and I'm learning all about it, but it's such a grand, big field. And I'm just now scratching the surface. I know a little bit of the research. I know a little bit about what works from a naturopathic standpoint and what from a conventional standpoint. But I don't think my understanding of autism in particular is something that I could step back and say, this is exactly what this patient needs at this time in order to get well in this moment. So at that point, I would refer to somebody who actually specializes in autism, for instance.
Very nice. Let's talk about medicine for a moment. Medications. I mean, in the Western world, we do put people on a lot of medications, and they're on these medications for life. And I talk to many healers that are not Western that are sometimes against that, but then they put people on supplements or other medications for life. So, is there a difference in naturopathy, being a naturopathic doctor? Do you put people on medications for life or supplements or herbals and botanicals? Or do you just treat people for periods of time and then take them off of things?
Well, that's a good question. There is a term in naturopathic medicine called green allopathy, which is essentially just saying instead of this pharmaceutical drug, we're going to give you this bottle of pills of this botanical medicine or this high dose vitamin in order to treat this disease. And so, for instance, if somebody comes in with high cholesterol, you know, the traditional approach would be let's give that person a statin, and you have to be on the statin for the rest of your life. There's usually very little conversation about diet, exercise, and such. You come to a naturopathic doctor, some naturopaths will just simply give you, for instance, red yeast rice, which is pretty much comparable to a statin pharmaceutical medication. So that would be considered green allopathy. It's just substituting a pharmaceutical drug with a more green version of a pharmaceutical drug. From my standpoint, it really comes to giving people what they need in the moment and making sure that they don't need to rely on any one thing for the rest of their life. And so I think that really is the value of naturopathic medicine in that we're really working with diet, lifestyle first and foremost. And so once that's in place and people actually make those really key changes, I find that they don't need to be on a multivitamin every day. They don't need to take ginseng every day. Again, yes, for a short period of time in order to move them in the direction of health and wellness, people often will need something as a crutch. But day in and day out, I try to make sure that my patients understand that they shouldn't be taking these things or relying on these things for the rest of their life. There are exceptions to that rule. For instance, I have a love of Triphala. Triphala is it's a Sanskrit, it's an Ayurvedic medicine. It's a Sanskrit word that means three fruits. And Triphala is one of those very bizarre, interesting medicines that actually the benefits actually accrue over time. And so the longer that you take it, the greater the effects will get. And so Triphala really targets digestive health first and foremost. And so from an Ayurvedic and a naturopathic standpoint, digestion is the root of all health. Which is a whole nother conversation, which we can go into at a later date. But digestion is the root of all health. And so Triphala really is just targeting digestive health, promoting digestive health, toning your intestinal tract, giving you some really good nutrition. It's doing all of these things. And again, the longer that you take it, the greater the effect is going to be. And so Triphala is one of those things that I personally have taken for several years. And I recommend to several of my patients that are open to it, to them taking it as well.
It's interesting. Yes, there's so much in this, and we can have many more conversations. You talk about the statins and cholesterol. There are lifestyle changes that need to be recognized and dealt with. And I work with a lot of people that don't want to take that statin, but are willing to take the red yeast rice, not realizing that it's the exact same chemical composition of the statin. Sometimes, though, uh, they have there are different doses. When you take a Western medicine, you usually know that this pill that has 500 milligrams of penicillin, PenVK, is going to be that. Whereas if you're eating red yeast rice, you don't necessarily know that the uh, dose is going to be the same each time. How do you work with people that in this country may just go to a health food store and hear about a medication? They may hear, for example, in this talk today about Triphala, and then they want to go out and find some somewhere, and they find it at a regular market, and they start taking that. Do you recommend that to people, or are you against that? Where do you fall into that category?
Well, not all supplements are created equally. You can walk into a mass market store and you can find a whole shelf, a whole array of dietary supplements and herbs. But really, those products are designed to sell first and foremost. So I often say that marketing is the primary or active ingredient in that product.
Very
And
nice.
I see that left and right. I think that there are exceptions. Fish oil is a product that you can buy at any mass market store, and it's going to be the same quality, more or less, that you're going to find at your doctor's office, because fish oil is coming from the same place. Granted, there are different potencies of fish oil, but fish oil is fish oil is fish oil is fish oil. You do see that mass market products are here. Then you have health food products, which are a tier above it. What I use clinically and what naturopaths use clinically are physician-only products. And so these are products made by doctors, for doctors, and those are the products that I recommend for my patients specifically because I know that they work. They're at the specific dose, again, using the specific extracts that are needed to exert a clinical effect. And so if somebody goes and they're wanting to use, coming back to ginseng, they may be using a very poor quality ginseng product, hoping to get that energetic boost that they've heard about. But you need to have a specific amount of active ingredient, or it needs to be harvested from a specific area of either the U.S. or China. In a very specific manner in order to make sure that it's the right type of plant. And so again, physician-only, physician-grade products really ensure this. And so I lean heavily on those type of products in my practice, which I consider more or less pharmaceutical grade. And I do substitute freely as pharmaceutical drugs. So hopefully that answered your question a little bit.
Yeah, I think in terms of ginseng is a very good example because in my understanding of studying the actual plant or the root, on one end of the root is the active ingredient, on the other end of the root is an antidote. And if the person that's trying to sell it and market it just grabs the root, grinds it up, and puts it into a capsule, someone may end up getting the antidote and the ingredient, and therefore they take it and get no effect, and then go on to say, well, ginseng really doesn't work for me. How does someone get a physician grade medication or supplement?
Well, currently you need to be working with a healthcare practitioner that is licensed and that understands these. So not all licensed healthcare practitioners obviously would give these out clinically. It needs to be somebody who is well versed in natural medicine and understands botanical medicines, nutritional medicines, etc. You can find a few of them online, but because these products really are higher force, I do caution people to be careful because it's not the products that you find at your typical store. These products really do work and they're quite powerful. And you need to make sure that you're looking at any drug interactions, any interactions with foods or other supplements that you may be taking, as well as making sure that you're just taking them in the right way. So really, you can find a few of these physician-only products online, but I would highly recommend working with somebody who understands this so that they can actually guide you and give you a customized treatment protocol using these specific products.
Good answer. Christina, I see why we need to have many shows with Nick.
Yes.
There's a lot of questions that come up.
There is, and I know that we can go on for a long time and days here, but we are coming up to the end of our hour. I mean, I'm loaded with questions right now. I'm like, oh, oh. So between Magical Medical Tour and Trinity of Life, I think we're going to be fighting over you, Nick.
Nick, we always ask our guest for a special healthcare tip, something that you've learned in your own journey and your own wisdom that our global audience can pick up from you. Seems like everything you say comes out as a healthcare tip. So I'm wondering if you have something that can go in its own special category just for Christina and I. We won't share it with anyone if you don't want us to.
That's funny.
This will be just a little secret.
But I'll tell you it on air right now. I mean, there are several tips and several things that I've personally found to be of value. For example, I have two things in mind. One thing that I love, it's called Abhyanga, and Abhyanga is self-massage. Abhyanga is an Ayurvedic concept. In Ayurveda, it's actually recommended to do this self-massage, an oil massage. It's a full-body oil massage every day before you get in the shower. And so you're basically, it's quite a beautiful process. It really is kind of an act of self-love. You're anointing yourself with oils on a daily basis. And depending on your body type, you would use a specific kind of oil. And so the best oil for all body types, irregardless, is sesame oil. So you buy a refined sesame oil. You basically are oiling up, not too heavily, but you're leaving a coat of oil on, and then you're leaving that on for about 10 minutes, and then you shower. And you don't rub it all off. You don't wash it all off. You leave a small coat of oil on the outside of your skin. And it just stays with you during the course of a day. And we find that what that is doing is actually it's lubricating all of your organs. If we find that people, they don't need to use lotion anymore once they start doing this. And it really helps to promote ojas. And ojas is another Ayurvedic kind of foreign concept that I would love to talk about at great length. But ojas is that glow that people have. And I call it the juiciness. And so my goal from an Ayurvedic perspective is always to promote juiciness in my patients. So the analogy being, people start out as these plump grapes, and during the course of their life, they slowly dry out and they turn into raisins. And that's when you actually get into all these health problems. And so the goal of Ayurveda is to reverse that. It's to increase the amount of ojas, the amount of juiciness that's in your body. And so one way of doing that is to do this daily self-massage. And so sesame oil is a very easy way to go. You can use olive oil. You can use coconut oil. I prefer coconut oil because I love the smell of it. But there's so many health benefits for that, and I could go on and on and on and on about that. But Abhyanga self-massage is one of my favorite things. And contrast hydrotherapy, so ending your showers on cold water. It's an old German nature cure concept where you basically are doing this contrast. So you're doing hot followed by cold therapy. And what that's doing, it's actually stimulating your vis, meaning that healing power inside of you. It boosts your immune system. It tones your muscles. It increases circulation. So people that have cold hands and cold feet will actually exude warmth when they get out of the shower. It gives you that sense of vitality. And it's just a really good way to wake up in the day. And so end your showers on cold. And all you need to do is maybe 30 seconds of cold. Just let it touch your thyroid gland and then usually your lower back where your kidneys are. It's a good way to really kind of just stimulate your internal chi or prana.
Yeah.
Oh, this is
I don't know if I
great.
could do that.
Well, because I shower in the evenings, I would find it hard. In the mornings, that's not a problem. I like that cold rush, but at night, right before I go to bed, wow, I wake up. I like completely whoa. But what's interesting, Nick, is what you said about oiling the body down before the shower, because I actually have in our shopping cart here at Yoga Hub, we have a Triphala oil, and it is Triphala infused into the sesame oil. And I usually end my day after my shower with the self massage as opposed to before the shower. So if you're to do it before the shower and then you go into the shower, does that mean we don't use any kind of soaps or any other cleaner, like what people would consider soap, right? Like a body soap or, or a glycerin soap or anything like that?
Yeah, I mean, just use a basic, very easy soap. I use Bronner's. Again, the intention is not to take off all of the oil. You really want to leave a small coat on, but you can clean yourself just the same way. The reason that you would do it before you get into the shower is to allow the heat and the water to really push those oils deep into your body. And so the thinking in Ayurvedic medicine is that it helps to loosen up the doshas, the vata, pitta, and kapha that you have in your tissues. And so when you do that, it moves it into your intestinal tract. So when you actually have a bowel movement, you actually move those doshas out of your body, and it actually helps to detoxify. And so part of that is you're loosening up those doshas that are lodged into your tissues. And so that's why it's important to make sure that you're driving those into your tissues. A lot of doctors will say oil up, then do some jumping jacks or do some yoga or something so you actually create that heat so you can actually move those oils into your body as well. And if it doesn't work for you to do before your shower, you can always just oil up after you get up out of the shower. Just be conscious that you will stain your towels or your clothes. And so make sure that your body has fully absorbed those oils before you go and put clothes on. But just, it's going to do either way. It's going to give you benefit when you're oiling up on a day-to-day basis or every other day, just oil up. It really is quite therapeutic. And, as I mentioned before, it's an act of self-love, which sounds kind of stupid, but when you actually start doing it, you start to understand the benefit of that. It's very therapeutic. And I think that most Americans lack what I call vitamin T, which is touch. And so I think that, even self-touch can be very therapeutic unto itself.
I like that. Vitamin T. I like that. I go for the vitamin H, which is the hug.
That's exactly.
Oh, this is fantastic. Okay, so I'm going to give that one a try since I have the oils here anyways, and it is Triphala oil as well.
Triphala will work. Yeah, you can infuse any oil into it. Oh, I'm sorry, any herb into the oil, and it will work.
Right, so. Right. It's lovely. It's really, really lovely, and it's cured so much of kids that have eczema and that have those issues. It's fantastic. So I will try the massage before and then kind of alternate the days,
There you go. Let me know how it goes. Yeah.
I will for sure. So
well, I'm grateful to our very special guest, Dr. Nick Bitz, our naturopathic physician, who can be seen on Magical Medical Tour now and Trinity of Life. Grateful for his sharing of his wisdom and expertise and experience with us. And I would like to thank all of my teachers and my healers who have helped me on my journey. I look forward to getting together with Christina and our audience again with another very special guest in another quadrant of the healthcare galaxy. And if anybody has ideas for the shows or specific issues that they want to talk about, please let us know. And we will bring someone on, a specialist in a field, or we will have some conversations about your concerns. So until our next meeting, I want to thank Nicholas and Christina, and I want to wish all of you optimal health. Bye, Nick.
Goodbye, guys. Thanks.
Thanks, Nick, again and again. And I just had a message come through to say, wow, those were the best tips. So kudos. Thank you so much, Nick, for joining us again. And I can't wait to have you back on Trinity. And of course, all of you, thank you so much for joining us here. And again, you can join us live every Tuesday at 10:30 a.m. Pacific Time, 1:30 Eastern Time for Magical Medical Tour. And of course, on Wednesdays at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Time for Trinity of Life. And we also invite you to find Glenn Woolman, our Dr. Glenn Woolman, at myyogahub.com/G Woolman, or on Twitter at Glenn Woolman, one word. And of course, through his own site, glennwoolman.com, where you can learn about his Metaphor Square breath and also his sleep suite if you are having issues sleeping in the evening. Believe me, it works. I have not made it through that CD. Okay. So until next time, we look forward to having you with us. Namaste.